Yeah, good evening, people. This is Vichitra from V Network. As usual, it's a Women with Wing program. Welcome you all. Before going to our Women with Wing program, let's have a small video about our V Network.
We Network Community is an online Facebook group and WhatsApp group, which we have created to provide networking, skill development and physical, mental, emotional and spiritual growth. We have 7 panels to help you. Panel 1, Education and Coaching Panel. Panel 2, Health and Wellness Panel. Panel 3, Spirituality, Mindfulness and Healing Panel. Panel 4, Small Medium Enterprises Guidance Panel. Panel 5, Tradition, Art, Dance and Music Panel. Panel 6, Food and Nutrition Panel. Panel 7, Fitness and Sports Panel. Benefits of membership. We help you in physical, mental, emotional, spiritual wellness and balancing yourself. We help you in expanding your network and you get a place to showcase your talents and knowledge where all kind of people are in one place. We help you enhance your skills required to be strong and successful in your business and attract abundance in your path. Join us to transform your lifestyle and take a journey of empowerment and be abundant. We invite you to join our membership to enhance, enrich and empower your journey with us. Email team1network@gmail.com. WhatsApp at 7010071227.
And this is all about our V Network Women Shakti and also a small video about our membership.
We have 2 types of membership. One is community membership. The second is panel membership. Community membership is where you can be inside the V Network community, Facebook group and WhatsApp group, where you can share your business promotions according to the V Network promotion schedules and get webinars on business developments, new business opportunities and get help from experts. The second is you can become a panel member where your promotion will be handled by the V Network, like making your products and service visible in the V Network live programs in Facebook, YouTube and Insta page. You can be a part of the V Network with personal care on your development and you can network with right and like-minded people and help others to empower. This is an area where you empower through empowering each other. It will be an amazing journey for you with V Network. We stand to empower each other. V Network Tribe is in the mission journey of Million Mind Success. Let's all come together to bring a brighter future for all of us. Register today. Email teamvnetwork@gmail.com. WhatsApp 70100712227.
Yeah, people, join as a member and let's grow together. And welcome you again to our Women with Wing program. Today we have a wonderful guest to our program, that is Dr. V.S. Gayathri, who is a counselor and also educational therapist and also a founder of Flourishing Kids. Welcome, Gayathri, ma'am.
Hello, ma'am. Nice to have you.
Yeah, thank you. And coming to our program, this month is October. October is recognized as a dyslexia month, right, ma'am?
Yes, ma'am. Yes,
Yeah,
it's Dyslexia Awareness month.
Okay, I know it's a learning disorder. That much only I know. Can you explain more about that?
Yeah, sure, ma'am.
Okay.
So good evening all. It's October month and this is specifically called as Dyslexia Awareness month. So dyslexia, as ma'am now said, yes, it's a learning disorder. Dyslexia actually refers to difficulty in reading. Difficulty, there's a specific learning difficulty in reading is called as dyslexia. The reading, we can see actually in the 3 different aspects for reading. Like the reading will be difficulty, the kid has difficulty in reading for the fluency and also in the comprehension. Word reading, fluency and comprehension. That is called dyslexia, the difficulty in reading. Yes, ma'am.
Okay. Ma'am, is it easy to identify, or we have any symptoms? Is the child is having dyslexia?
Yeah, ma'am. So yes, ma'am. It is like we can identify it. We can identify it in the pre-primary level itself. That
Okay.
is before actually the kid goes to first standard itself. We can identify. There are some red flags. Those red flags actually we cannot see just one single red flag or anything, but we have to see them whether they are in the cluster, and if they are repeating again and again, even after giving a proper set of instructions and proper methods, if the kid is having those things, we have to have a proper assessment. But there are some red signs, so I will explain those red flags so that we can know better like what should we check out for in our kids. So for the pre-primary stage, for them the difficulties is with they have difficulty to appreciate the rhymes. If there are simple nursery rhymes, they have difficulty to appreciate whether they are the rhyming words. They can't understand much of the rhyming words. If you say something like mat, cat, bat, they will not able to appreciate that it is the same rhyming word which is repeating. So again, to name the familiar objects, they will have a difficulty. Suppose if they already know this is a table, this is light, everything, but still they get confused. If suddenly someone asks it, or if they want to say by themselves, they will get stuck. They don't remember those terms or don't remember those words exactly. And the main thing is they have difficulty to follow a sequence of instructions. Suppose you say that, go open your bag, take your notebook, open the page number 4. It is very difficult for them because it's a 3 set of instructions and they find it very difficult. And they also have difficulty with time and space. They cannot manage that much time. Maybe those are small kids and they cannot know exactly the time, but they will be spending on the same task for such a long period of time, but they don't know that the time is passing away, or they will be still working on it. Or sometimes the space is difficult. The kids may wear their bag and they can move around in the classroom or something. Then the other kid will be saying, usually he hits me, ma'am. He's hitting me over here. While they're sitting also, they don't know that they have to sit in the space. So they have difficulties with the space and time. These are the signs in pre-primary stage.
Okay.
The same,
Ma'am, in what
yeah, ma'am.
age we can identify this pre-primary stage?
Yes, ma'am. So actually, we can start early identification when they are in the preschool itself. Actually, when they are in the pre-KG itself, we can early identify. But for formal assessment and diagnosis, it is around 8 years. But we need not wait for that. We can have a early intervention if we find them early and give them the remediation and the proper techniques.
Okay.
Yeah, ma'am. Yes.
If the child is facing difficulty in differentiate the things and time and space, these are all the symptoms.
Yes, ma'am.
Once
Yes,
we
ma'am.
notice this, we have to take the proper
Yes.
action, right, ma'am?
Yes, ma'am. Yes, ma'am. We have to take it. Like we have to see the kid's age and we have to see what all other things the kid is having difficulty also. Okay. Then we can identify that the kid is having some difficulty. Okay. Next, actually, while going to the primary stage, this is where we can identify the kids very easily, because these kids are like they're in around first standard or towards the end of UKG. They still have confusion, auditory confusion. They will have auditory confusion between the sounds B and D. If they are hearing any word ending with B, like suppose you are saying like cab, they will hear it as cad, b, d. Oh. They hear both as same. They have those kind of auditory confusion. Okay. And next is visual confusion. Visual confusion is between the same letters kind of. If B and D is there, they will actually have a confusion. Whether this is B or D. Okay. Or D. It also occurs like M and W. Like upside down. They also have, yeah, they also have those kind of confusion. Okay. Then sometimes if they are reading a word, they will kind of add some letters and read the word. Addition will be there. The letters will be added somewhere. Sometimes they substitute the letters also. So sometimes they add a little small word, etc. word into that word. They will be adding it. Or if the word is a very big word and it is divided into parts, they will miss one part and read the whole word. They will miss, so they kind of do substitutions and they do guessing a lot. For them, any word, if it is a 3-letter word and it is starting with C, it is always cat, because they just guess it. Okay, it's starting with C because they know cat is a common word we use, so it is cat.
Yeah.
So they kind of always keep guessing it.
Okay.
And next is if they are reading something, if they are reading a 3 to 4 line passage, they will lose the thread. They will start with the first line, then they will leave the second line, then they will go to the third line. They don't know that they are leaving a single line in between, because they will not understand the lines, or they will be having difficulty to read, so they will be missing out lines. Then flat reading. Flat reading is that if you have the same tone for all the words, they have to give a difference. If it's a question, you ask like, what are you doing? You have to have a different pass. And when it's a statement, you have to just do a flat one. So they don't do that. They do all words in the same tone. They won't be appreciating
In
that
the
much.
modulation. Okay.
Yes, the modulations they won't be appreciating. They don't, and the punctuations are different. It is difficult for them. All the punctuations are same for them. Sometimes they even change the tense. If it is written in present tense, they will be saying in the past tense. They will be changing it. For complicated words, they actually kind of replace their own words itself. If it is like an apartment, it's a different thing. It's a difficult thing. If you ask them to write, they'll say house, because house is easy.
Oh,
To write apartment, because they don't want to choose the
whichever is
complicated
easy, they
words.
will took that.
Yeah, they will take the easy words, and they will take the words which they know frequently they're using.
Okay.
So they will be just substituting those kind of words. These are all difficulties we can identify in the primary stage kids.
Okay.
So these are kind of difficulties.
Okay.
Yeah.
Gayathri, if you said many symptoms, no, many difficulties,
Yes,
no.
ma'am.
If one or two may occur, or everything, whatever you say, everything will occur in the in a kid.
It's not that everything have to occur in the kid,
Okay.
but just with one sign, and just if the kid does for some 2-3 weeks, you cannot take that as a sign, because all kids will do that. And this confusion which I mentioned, you exactly asked me, this visual confusion, the B and D, the reversal letters, that is very common for kids till 7 years. Yeah, it is very common, because the
Every
brain
kid will
persists.
face the learning difficulty in one or other point, no?
Yes.
Okay.
Yeah, till 7 years, for them, the brain receives B and D as the same thing.
Mm-hmm.
So they have that kind of difficulty. For them, if you see a tree and the branch goes left or right, it is the same. So that is what same for them. B is also same, D is also same. But so we can't just take one or two signs. We have to see, and we will be giving an assessment for the kids. And after the assessment only, we can completely tell whether the kid needs any early intervention.
But if we notice these symptoms, we have to take it as an important thing, and have to make them to do assessment, right?
Yes. We have to address it as soon as possible.
Okay.
Yes.
Will it be rectified?
Yes. So actually, dyslexia is not a disease.
Okay.
It's a condition. It's a condition. So dyslexia will be there. It won't be kind of cured, but we can give them strategies and techniques. And with the systematic, thorough, direct instructions, they can use those techniques and strategies, and they can do extraordinarily well. But they need those strategies and everything for them to do. But dyslexia doesn't disappear. It is there, and it will be there, but they will learn how to handle the challenges.
Okay. Yeah. We have to teach them how to overcome this, but it's never go off, right?
Yeah, it never goes off. It never goes off.
Okay. Will it affect the academic performance? If you're telling no, this will never go off, then how will the kid who is having dyslexia will continue the academic process and all?
Yes, ma'am. So for academics, like the kid will have difficulties. For academics only, like we kind of give the kid remediation classes. These classes especially focus on the difficulties of the kid, and we kind of give them strategies for the kid. So if the same word we are teaching cat, for some kids, if we just say it's a cat, C-A-T, cat, the kid can understand. But for these kids, if I'm teaching the same word cat for this kid, we have to kind of first teach them the sounds for the word cat, k, at, t. We have to teach from the sounds. We have to also give them materials, and we have to make them do some kinesthetic activities, and we have to incorporate all kind of techniques. It's using all multi-sensory teaching that will be beneficial, and then the kid will take it forward once they understand the concept. So this is what
they will follow the strategy throughout.
Yeah, they will follow throughout their life, and they can understand, like they have these challenges, but they know how to handle them.
They can also shine in the academics also, right?
Definitely. They can shine in their academics also. Yeah.
And one more doubt, Gayathri, if the age increases, if we not notice about the dyslexia, I keep having dyslexia.
Yes, ma'am.
We didn't notice that she is going in class grade 1, 2, 3 and all. Will this dyslexia increases?
Yes, ma'am. This is like we say like a learning gap.
Okay.
For a first standard kid, if I'm identifying them at the correct age, at 6 years, I can give them strategies until third standard. Actually, the kid learns to read. Okay. But after third standard, it is like you have to read to learn, because there will be new higher concept. So it will take time for those kids, but we can actually approach them and we can give the techniques and everything, but it will become difficult. At that point, we have to see kind of whether the difficulty is like mild, moderate, or severe. If it is going on a severe, then we have to look out for accommodations also for the kid. There are many exam accommodations, everything. We have to look out for that in case if it goes to the severe.
In any stages, it is possible to overcome this dyslexia.
Yes, it is possible to, it is possible to overcome. Just that we have to take care of the learning gap. If it keeps on widening, it becomes difficult for the kid, and we have to look out for the emotional aspect of the kid also. That is very, very important. The kid will know that there is something difficult. There is something different. All my friends write the answers. All my friends read it. But why I can't do? The kid's self-confidence and self-esteem plays a major role. That's why we have to identify the kids as early as possible. Yes.
Thanks a lot, Gayathri. And is there any separate school for this dyslexia programs and strategies and all?
Yes, ma'am. Actually, as I said, if it is in the severe stage, if it is like, we don't say stage kind of thing, if it is severe and the kid actually needs many accommodations and it is difficult for them to cope with the traditional schools, then you have to go to a learning center. It's a different school itself. But if it is not in that way, and we can actually give them remediation, just like 3 to 4 hours extra. Other than their school timings, we can just give them extra classes. And with these classes, they can actually manage in the traditional schools itself. No need to go to, again, a new school or a different school.
Okay. Yes. If a kid having, if we notice dyslexia in one kid, if they are going to a normal school, we have to take him to special classes or a special kind of teaching, like tuitions and all. Is it necessary?
Yes, ma'am. So actually, I just wanted to say one thing over here. Many times parents get confused like with tuitions and the remediation classes.
Okay.
Tuitions is like tuition teachers generally like they use the same techniques what they use in classrooms and they teach the kid. But sometimes what happens for these kids with dyslexia or learning challenges, they need a different technique. So you have to go for a remediation class where actually an educational therapist like me or a special educator, they work upon. They will work upon the kid, and it is like remediation classes usually is for one-on-one approach. You usually have one kid at a time. It is like a specialized and individualistic approach for each kid. That is the different thing.
We have 10 or many people, and one teacher will teach everything at one stretch. But but in remediation classes, you see each kid one by one, right?
Yes, ma'am. We will handle one is to one ratio. Yes. That's a different thing.
Okay, Gayathri. And what are all the positive signs when the kid is coming to remediation classes? You noticed as an expert.
Okay. Yes, ma'am.
You saw many students know Dr. Gayathri, and what are the positive signs you noticed from them?
Okay. Yeah. The first sign is that within 3 months, you can see the kid becoming confident on themselves.
Okay.
They'll be more confident. They understand that we can read these words. Sometimes it's because they'll be exposed to higher books or anything. But when we give them the books accordingly, they actually become more confident. And I get videos from parents while the kid is reading. I have got many videos like that. The parent will take a video and send me. See, my kid is reading completely by themselves. So first thing is the self-confidence for the kid. And next is that in school also, they are like little more calmer than before because they are not that anxious. They know that they have to write it down or they have to copy it down, and they are little anxious. Their anxiousness is also reduced in schools. That is the first sign I can actually appreciate much in kids. Yeah.
Okay, okay.
Yes, ma'am.
That will be
Okay.
that will bring more self-satisfaction to you, right, Dr. Gayathri?
Definitely, definitely. It's like more satisfying when
Yeah,
the kid
yeah.
is able to
That's
read.
important in every profession.
Yes, yes,
Okay,
definitely.
okay.
Yeah, yeah, ma'am.
In
Yeah.
how many days you will notice these signs when a kid coming to
Okay.
your classes?
Yeah, it will actually take at least 3 months to build a rapport
Oh,
between us and the kid. And we also should know, like, there is a different style. And the different style I mean is that each kid will be different.
okay.
And the kids' pace we have to understand. We have to understand their learning style, and we have to actually approach. So at least 3 months. It will take easily 3 months to just see first thing. Then only we can say like how the kid will actually kind of understand things and how much time will it take to address those issues. Yeah. Yes.
Okay, thanks, Dr. Gayatri. And one more thing, whether we have to inform the school teacher or school teachers, where my kid is having dyslexia, please take care of her. Whether it is important to inform the school.
Yes, ma'am. Yes, ma'am. Definitely, you have to inform. And most of the times, teachers also see that, and teachers itself will call the parents and address this.
Yeah.
If the
Because
parent
they
is
know the
addressing,
difference between
yeah,
kids, no?
yes,
Yeah.
yeah, they will understand. And sometimes, if the parent is noticing, first thing you have to address it and you have to take it to the class teacher. That
Okay.
is for sure. Because when we are conducting an assessment itself for the kid, if you are conducting an assessment, we will take an interview from the teacher also. Like
Okay.
as we take from the parents, we'll be taking a direct interview, or sometimes we'll be giving a questionnaire to the teacher, and we'll ask them to fill it up for us and get it, so that the teacher will be seeing some things in the
Yeah.
academics and they know those things. And
How the
it's
kid
definitely,
behaving at school.
yes, yes, we have to definitely tell the teacher. And the teacher, parent, and an educational therapist together only will work always for the kid. That
Oh,
is the triangle for working out. Yeah.
super, super,
Yeah.
super.
Yes.
If the kid is have once taken the dyslexia class, whether he or she has to take it continuously till finishing her academics, or in some stages, if she or he is okay, means we can stop the class.
Yes, ma'am. So actually, it is like at least the kid will require 2 years. Usually, the classes are extending for 2 years, but we can't say 2 years is like a definite point. It depends on each kid, and for some kids, it has to continue till they complete academics. Also, for some kids, if they grow up, we'll kind of teach them the study skills for them. So
Okay.
those are all called study skills. How to learn it by themselves? How can they use it? Those strategies and skills. If once the kid is little elder, and we think that okay, we have already equipped the kid everything, so those study skills are sufficient for the kid. So
Okay.
it depends on the kid whether it has to be continued, or for some kids it need not continue. They will actually able to, they can continue by themselves. And we'll be actually kind of giving those study skills and approaches how to go ahead with their life. Yeah.
Okay. Okay.
Yes.
Thanks, Gayatri. Thanks for explaining about dyslexia. And any other thing you want to tell about dyslexia?
Yes. So actually, I just wanted to convey about Go Red campaign
Okay.
happening now in this October month.
Okay.
I just wanted to say specifically about this because Go Red, it is globally chosen. The color is red. Red is usually like we see in the answer sheets where the teacher kind of underlines and marks
Yeah,
everything
put
that is
marks.
wrong. So the red is kind of a dreaded color.
Alert.
As when we were students also, we will think that if there is a red mark on our paper, it's like something wrong. I have done something wrong. For these kids, actually, they already have those reading and spelling challenges, everything. So for them, it is always difficult for them. So there will be many red signs. So as such, so this color is taken as a Dyslexia Awareness Month color. So everyone, it's like we understand the dyslexics, they need a different learning style. They need a different teaching style, basically. So it's like Go Red for this month. Everywhere its campaign is going on. Just you have to go red for one day, and you have to post on every media, and so that
About
your
bringing
friends,
awareness about this.
yeah, it is bringing awareness. Your friends will know it, and the
Yeah,
dyslexic
many
learners,
people
they also,
may not know this is dyslexia. This is an
yes,
this
yeah,
is curable, like that and all.
yes,
They don't know.
yeah,
No?
yeah,
Yeah.
yeah. They don't know. They think that it is some disease, and
Yeah.
it's that the kid will outgrow it. If they grow up little, it will become okay. If my kid goes to sixth standard, it will become okay. They have kind of these things. And so we have to bring an awareness so that everyone understands that there is dyslexia, and we can give them the strategies and techniques. And yes, they can actually achieve. There are many people who have achieved with dyslexia, and so their kid also can achieve. And one more thing is dyslexia, it occurs 1 in 10 people.
Okay.
So it is not that rare. So it is not very rare. So if we are giving awareness, maybe it will be helpful for our friend or anyone in our close circle itself. They will understand that there is something called dyslexia and we have to address it for our kids. So Go Red campaign is going everywhere, and I want all of you also to participate in this campaign. Actually,
yeah, definitely, yes. Gayathri, Dr. Gayathri, we will do it. And
sure,
one more thing, Gayathri, is this the dyslexia class? Is you're saying no? Is this affordable for all the people? How is the fee structure?
Yes, ma'am. So this is kind of, it differs, ma'am. It differs actually with each special educators. Yes, it is like kind of sometimes it becomes little difficult if you're approaching it privately. But in schools itself, there are classes for dyslexia kids, and there also it is approachable. But as a long term, if a parent is seeing you're investing it for the school's fee and everything we are investing, and we have to see our kids' confidence levels also, because kids' self-confidence levels are being affected. And if we give them the proper approach, it is like easy. So it depends on the classes also. But actually, it's like only weekly, you're handling only 3 to 4 classes. And most of the times, I see that it's not that difficult for parents. But for few parents, there will be approaches in schools itself for who they cannot afford it or anything. And they can be approached in schools so that the schools can also handle. The counselor there or specific teachers will handle those kids. Yeah.
Okay, Dr. Gayathri, thanks a lot for coming here and explaining about this dyslexia and giving more confident about this. This is not a very big problem. We can overcome this. That and all. It's a really wonderful speech from you. And thanks a lot for coming here and giving a wonderful speech. Thanks a lot, Gayathri.
Yeah, ma'am. Yeah, ma'am.
Okay, and people, this dyslexia is not a very big problem. It can be overcome by different strategies that we can go to some classes and will improve the confidence of our kid. And as Dr. Gayathri said, please go Red and bring the awareness about this dyslexia and make the kids' life brightful. And thanks for watching this. And this is Vichitra signing off. Have a great evening.
Yes, thank you all. Thank you all for having me over the VNetwork platform. So the main things I wanted to say is dyslexia is not a disease. Dyslexia is not related to IQ also. It is not, the kids will have a low IQ or anything. So it is not at all related to their IQ issues. So please be aware that if your kid is having any learning challenge, address them as early as possible. Thank you so much.
Yeah, Dr. Gayathri's Flourishing Kids and about this dyslexia classes video is going here. Please note it and make use of it, people. Thank you. And please note her number.